Okay, I ran into this article out of Market Watch, and it basically, a lot of people want to know or they wonder when this thing of COVID is going to be over. And so I found this article interesting. And I also somewhat agree that there is a strong possibility that this is the new normal, as they say. We will be living with this and maybe many other viruses that will come thereafter. Some might be not as threatening, life threatening, and others might be a little more problematic or more serious than others. So, out of Market Watch, it says your great 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 grandchildren will still be getting immunized against coronavirus. This Mayo Clinic doctor says it's too late to eradicate COVID-19. So this is by a Quentin Fort, or not Fortel, but Fotrell. So will SARS-CoV-2 coronavirus be eradicated? No, it will not, says Dr. Gregory Poland. And this is him pictured here, who studies immunogenics of vaccine response at the Mayo Clinic. And so let's get his take on this. So Dr. Gregory Poland, who studies immunogenics of vaccine responses at the Mayo Clinic, talked about the prospects of COVID-19 becoming an endemic. And that's what a lot of people have on their minds. When is this going to be over? So will we ever live in a world without COVID-19? So in the third year, as we move forward, many people are wondering if COVID-19, the disease that is caused by SARS-CoV-2, will be an endemic. Endemic refers to the observed level of the disease or the baseline predictable level with seasonal fluctuations like the flu, whereas a pandemic is typically a global public health emergency with an unpredictable level of illness and even or death. So that is a long ways off. So COVID-19 will always be with us, Dr. Gregory Poland, who studies immunogenics, a vaccine response at the Mayo Clinic, told Market Watch and Barron's in a live video interview on Wednesday. Measles, a highly contagious airborne virus spread through coughing, sneezing, serves as a good point of comparison. It is a stable virus and does not change with no variants, such as measles has, for the most part, been eradicated in the U.S. Will there come a day when COVID-19 goes away, just like measles? We're hoping one day measles will be eradicated, but will that happen with coronavirus? This is his answer: no, it will not, Poland said. We are not at any stage where we could predict endemicity. So we're not going to eradicate it. And we have an animal reservoir now. White-tailed deer in the U.S. that are infected with SARS-CoV-2, for example. So let me make a prediction, which will be hard for any of you to hold me to, because we will all be dead by then. But your great grandchildren will still be getting immunized against coronavirus, he added. How can I even say such a thing? If you got your flu vaccine this fall, you were immunized against a strain of influenza that showed up in 1918 and caused a pandemic. So, coronavirus, there are updates and additional articles along with this one, but he goes on to say that COVID-19 in numbers has killed 853,230 Americans. Currently, there is a daily average of 753,990 new cases in the U.S., up to 29% over 2 weeks, according to the New York Times tracker. Deaths currently have a daily average of 1,971, and they're up by 48% over 14 days. The COVID-19 Scenario Model Hub estimates that deaths to mid-March could be between 50,000 to 300,000. A recent Viewpoint essay in the Journal of American Medical Association suggested that Biden administration needs to address the fact that COVID-19 is here to stay with us. As the U.S. moves from crisis to control, this national strategy needs to be updated, so policymakers need to specify the goals and strategies for the new normal, as they say, of life with COVID-19 and communicate them clearly to the public. So the new normal does not include eradication or elimination of humanity. So neither COVID-19 vaccine nor infection appear to confer lifelong immunity. Current vaccines do not offer sterilizing immunity against SARS-CoV-2 infection. So infectious disease cannot be eradicated when there is a limited long-term immunity following infection or vaccination or non-human reservoirs of infection. So basically, that is the article. And I know it sounds pretty grim, but it's short and to the point, and I really do believe that this is what I had seen or foresaw, because there are so many things that point, to this being here. It has evolved. It has other mutations. There are 2 sub-mutations of Omicron that have showed up in 20 cases in Israel, probably more than we know, are spreading. Most of the kids are getting it, and there has, as of last week, 580,000 children in the U.S. tested positive. So all that talk about the kids can't get it, that was proven wrong. The kids can get it if they're exposed to it. And so what I have seen here in South Los Angeles is there has been an explosion of this disease. You'll see still people walking around with no mask, or their mask is down on their chin, or they have one flimsy mask, or the mask looks like they're wearing it for the whole week and it doesn't have any protection whatsoever. Then you have kids that they're not wearing any masks, adults not wearing any masks, people going into stores not wearing masks, people acting like this virus isn't even real, like it doesn't exist. And so there is an explosion going on. But you have, on the other hand, ambulance coming around every hour. There's a fire truck and an ambulance or EMS technician. Then there are people that are going into the hospital sick, and the hospitals are full, and you can't get a regular appointment because there's so many people in there with COVID, and people are scared to go to the doctor, or they're scared to go to the dentist. They're scared they're going to be more around people who could possibly give it to them. And so at the jobs or the businesses, when somebody has it, they continue to keep the places open until it gets so bad that they're forced to close. It's doing just what I had thought it was going to do. So there's been pressure on the CDC, I believe, to shorten the number of days of quarantine because people's livelihoods are dependent on having money to feed their families because of inflation. They said Omicron was mild. It isn't. When you look at people getting evicted, people having to go to work sick possibly, people not really knowing if they're going to get infected if they go to the store to go shopping for groceries, And then you have all of these changes and rules and mandates in place, and you have to be ready for whatever when it comes your way. This is an explosion of this disease. It's highly contagious, and you don't know where you could end up catching it. There are children that haven't gotten vaccinated because their parents haven't gotten vaccinated. So those kids are playing around outside. They could be sick, they could be carriers. Some of those kids have ended up getting so sick that they end up in the hospital with it. And so there are people that are not only what they say climate deniers, there are COVID deniers. And so there are people that they could be walking around infected and they willfully, with ignorance, infect others. There was a COVID line where they had one group that was parents and students. Nobody was social distancing in that COVID line, and it was wrapped around the building. People are frustrated, they're tired of waiting, so they don't even separate and get 6 feet apart. They just want to hurry up, take the test, and leave. Then there's the other line for people that might be an employee of a job or staff, and they have maybe made early appointments. People walking up to the line who should be in cars because they've either come in contact with somebody that has symptoms or they themselves are having symptoms. And they're in these tight-knit lines around people. Let's say you don't have it, but now somebody walks up, they have symptoms, they're next to you in line, and they're not standing far apart from you, and they give it to you. And so that is what has been going on. The lines have been crazy long because the jobs demand that you get tested every week. And some parents are frustrated when they try to test their kids for school purposes, and sometimes they won't test the kid. And so they say, oh, the kid didn't take a test, and then they just leave the kid at a school and drop him off. And that kid is infected, and now the staff's infected, and other children become infected. And it actually works really bad on a household where if it's hard for you to social distance because there's a lot of family members living in your household. So this has not been a mild disease by no way or stretch of the imagination. This has not been mild. It's not been mild on people's wallets. I can tell you that much, because that's the reason why the CDC had pressure to make the quarantine shorter, because people are worried about getting evicted. So there's a lot of things that are happening throughout this pandemic that have been not only worrisome, but it's been dangerous. It's put a lot of lives at risk, and also people have died. Many people have died. And then you have lots of people that have been getting sick, and they have not caught just one time this disease. There are people that have caught this disease maybe 2 or 3 times over. So that's how contagious this thing is. And even though they said, oh, you could have super immunity, I don't know who's writing these articles saying you can have super immunity, but what I've seen is if you have super immunity, then why do you catch it 2, 3 times? So you must not be that immune. So yeah, you're going to catch it, and maybe you have some level of immunity, but it seems like whatever that is, it doesn't last. You can still end up catching it. I feel like this virus has learned how to get around the vaccine, and it is evolving. It's getting smarter. Yes, I said that, to where eventually there will come a time where there'll be something that's a little more not only contagious, but also deadly and contagious. And it's only a matter of time. And I think our demise is the different opinions and different viewpoints on how people feel about this. You got some people wearing masks, some people who are frustrated with the CDC, then you have some people who don't believe it, or they're part of groups or cults, or maybe they think that this is a hoax. There's all kind of different mindsets out there, and so I think that's the reason why this thing is going to get worse. And so with that being said, I'm going to let this go, but yeah, I in a lot of ways agree with this Dr. Gregory Poland, that if we'd had flu And the flu shot helps us. This flu, we don't even really get scared about it anymore because we're here and we know we can get a shot for the different strains. But this, at one time, this flu virus was so scary back in, what did he say, the early 1900s, when it was a pandemic. And so flu in 1918 was a pandemic. And so we are not in the year of 1918. So just think of how many decades that has been. And here we are. Now we have something new out, a lot of new viruses, and people are wondering when this is going to end. And I believe he's right. Viruses can't be cured, they can be controlled. And so there is no end to this. There's only discipline, people doing the right things, and you can only get so many people that'll do the right things, right? So you can imagine where this is going. And so the thing that I think could end up happening with this is it could only get worse before it gets better. It's left up to human activity and how our habits are and what we do, if we're washing our hands, if we're wearing masks, if we're getting inoculated. But there's only so much limited immunity, he says in this article. There's a limited amount of immunity. So even when we get the flu shot, you can have one flu one year and have a cold and maybe it knock you off your feet, but you can get up and you can heal from that or whatever. But then next year you could have a different strain of flu and you might end up in the hospital. So I feel like this virus is unpredictable. You can't say that it's mild because what may seem like a cold for one person, that other person gets it's pneumonia, and now they're on a ventilator. So I don't think they should be calling it mild at all. And if you look at what it's done so far, they've had to make decisions about jobs. They've had to make decisions about if they're going to be able to live where they're going to live. How are they going to pay their bills? How long is quarantine? Who's sick? Does somebody have to go in the hospital? No, that isn't mild. Not at all.